Okay, let's dive right in. If you're studying for an exam, you know just memorizing names of diseases isn't going to cut it. You have to understand the why, that step-by-step story of what's actually happening inside the body. And that's exactly what we're going to do here, a visual walkthrough of how STIs invade, how the body fights back, and how they spread. To really get a sense of the scale we're dealing with, let's start with this number, $16 billion. That's the estimated cost of STIs to the US healthcare system every single year. It's a massive figure, and it tells you just how widespread this problem really is. You know, the CDC calls it the hidden epidemic, and for a really good reason. A lot of these infections don't have any symptoms, so people are walking around spreading them, and they don't even know it. So today, we're going to pull back the curtain on that hidden process. We're going to follow the pathogen's journey in 4 stages. First, the invasion, then the local battle, after that, the systemic spread, and finally, the long-term consequences.
All right, Section 1, the invasion. Look, every infection has to start somewhere, right? It starts with a breach. Our bodies have some pretty amazing defenses, but STI pathogens are absolute pros at finding the weak spots. They don't just land anywhere. They have specific targets, these vulnerable areas where they can get a foothold.
So where are these weak spots? Well, the main targets are mucous membranes. Think about it. The lining of your mouth, vagina, or rectum isn't like the tough skin on your arm. It's thin, it's moist, it's permeable, which makes it a much easier doorway for pathogens to get through. Same goes for the inner foreskin or any little cut or scrape in the skin. And what's really important for you to know is that in younger women, the very cells on the cervix are biologically more susceptible, putting them at a higher risk.
And this is what it looks like on the microscopic level. You're looking at the bacteria that causes gonorrhea. And you see those tiny little hair-like things sticking out? Those are called pili. You can think of them like tiny grappling hooks. The bacteria use these to latch on tight to our cells so they don't get flushed away. It's pretty clever, actually. So let's just map that process out, step by step. First, there's contact with one of those vulnerable mucous membranes. Second, the pathogen uses its tools, like those pili, to attach. Third, it actually gets inside the host cell, basically hijacking it to make more copies of itself. And finally, all of this starts to damage the tissue, which is what triggers the body's alarm bells to go off. Okay, that brings us to Section 2, the local battle. Once that invasion happens, our body doesn't just sit back and take it. Oh no, it launches an immediate counterattack. And this fight, this local battle between the pathogen and our immune system, is what causes the classic initial symptoms of a lot of STIs. But the way that battle plays out can look totally different depending on the bug. Let's compare 2 classic examples, gonorrhea and syphilis. With gonorrhea, the body wages an all-out war. It sends in a massive, rapid inflammatory response, tons of white blood cells rushing to the scene. The result? Pus. That purulent discharge is literally the wreckage from that fierce battle. Now, with syphilis, the body's strategy is completely different. It tries to contain the invader, walling it off in what we call a granulomatous reaction. This forms a single, firm ulcer, the chancre, which is often painless and super easy to miss. And wow, this image just says it all, doesn't it? On the left, you've got gonococcal cervicitis. See how red and inflamed it is with that pus-filled discharge? That's the widespread war we were talking about. But then look at the right, that's the syphilitic chancre. It's a clean, defined, firm ulcer. It doesn't look nearly as angry because the fight is contained in that one spot, not raging across the whole surface. So for your exams, you absolutely have to remember this definition. A chancre is that first lesion of primary syphilis, and what's its most important feature? It's typically painless, and that right there is the hidden epidemic in action. Because it doesn't hurt, someone might not even notice it's there, allowing the infection to quietly move on to the next stage. So what happens if that local battle is lost? Or if the infection is never treated because, well, nobody knew it was there? That brings us to Section 3, going systemic. This is when the pathogens break out from that initial site, get into the bloodstream, and spread through the entire body. An STI goes from being a local issue to a full-body systemic disease, and syphilis is the textbook example of how this happens. This timeline is chilling because it shows the predictable path of untreated syphilis. It starts with that primary stage, the local chancre. But even after that sore heals up, the bacteria are multiplying. A few weeks later, boom, you hit the secondary stage. The bacteria are in the blood, spreading everywhere, and causing symptoms all over the body. Then it can go quiet, latent, for years, all while the person can still transmit it, before potentially re-emerging in that devastating tertiary stage, causing damage to the heart, brain, and bones. And this is one of the classic signs of that secondary systemic stage. It's a rash that very characteristically appears on the palms of the hands and the soles of the feet. When you see this, you are literally looking at a visible sign of a body-wide infection. The bacteria have escaped, and they're causing immune reactions all over the place. And hey, syphilis isn't the only one that can go systemic. It's a lot less common, but gonorrhea can also break out into the bloodstream. This is called disseminated gonococcal infection, or DGI, and it is a life-threatening emergency. It can cause excruciating joint pain, meningitis, and even an infection of the heart lining called endocarditis. All of this leads us to our final and maybe most important section, the aftermath. When these infections are left to smolder, the damage from both the bug itself and the body's long fight against it can lead to severe long-term problems. This is where we get into the really critical must-know clinical concepts. And let's be really clear about this. The damage isn't always something that just heals up and goes away. We're talking about permanent, irreversible changes to the body. The inflammation and scarring from these battles can alter tissues and organs for life. The stakes for missing a diagnosis are incredibly high. So here's what that damage can look like. Inflammation from chlamydia or gonorrhea can travel up into the uterus and fallopian tubes, causing pelvic inflammatory disease, or PID. This creates scar tissue that can block the tubes, leading to infertility or a life-threatening ectopic pregnancy. Infections can be passed down from a mother to her baby during birth. That's called vertical transmission. As we saw, tertiary syphilis can destroy the heart and brain. And finally, having the sores and inflammation from one STI basically opens the door and makes it way easier to get infected with another one, like HIV. This is just a tragic, powerful example of vertical transmission. This little newborn got gonorrhea passing through the birth canal. The eye infection that results can cause ulcers on the cornea and lead to permanent blindness. It's heartbreaking, especially because it's almost entirely preventable. This is why most states require all newborns to get antibiotic eye drops right after birth. And here's another image you won't forget. This is another consequence of vertical transmission. If a mother's syphilis isn't treated during pregnancy, the bacteria can cross the placenta and infect the developing baby. This can lead to later problems, like Hutchinson's teeth, these permanently notched and misshapen incisors. It is a lifelong physical sign of an infection that could have been prevented. So how do we stop all this from happening? What's our job as healthcare providers? Well, it really boils down to these 4 clinical keys. Number 1, screening. Because so many of these are silent, we have to actively look for them. Number 2, early treatment. When we find something, we hit it fast with antibiotics to cure the infection and stop that cascade of damage. Number 3, partner treatment. This is crucial to stop the back and forth chain of reinfection. And finally, number 4, education. Talking to people about safer sex practices. So I'll leave you with this question to think about. We've seen today that the invasion is microscopic, and that initial battle inside the body is often completely silent. A person can feel totally fine while this whole serious disease process is getting started. Knowing that, how does it change your perspective on routine screening? Not just for people who have symptoms, but for everyone who might be at risk.